Hello everyone, Namaskar. So homeopathic treatment is a God's gift for us. But if you find a right doctor, as I introduced you in the last video, Dr. Satyashekhar sir, who is a famous, so especially in homeopathic treatments, many people got cured. Now, many of you have requested that women-related problems. We want a doctor. Dr. Satyashekhar sir, Mrs. is there, Nandita Rao, Dr. Nandita Rao Garo. So she is going to give us some clarity and some treatments specially related to the women problem. So we will discuss, and it will be definitely useful program for you all. And we will discuss a lot more things from Madam. Good morning, Madam. Warm welcome to our channel. Our channel followers are eagerly waiting and they wanted to hear from you. So first, please introduce yourself, Madam.
Hello friends, good morning. I'm Dr. Nandita and I have done my BHMS from JSPS College, Hyderabad, and I have an experience of 24 years in this field. I have been seeing cases of all types, like female problems. I have treated many patients with great results, and all the patients are really happy with me. And we have also treated many cases with like fevers, renal stones, and other gastric problems and psychological problems, psychiatry issues, and others. So now I'm happy to see you all, and I want to tell you here about all the female problems, and regarding those issues, we want to give you some knowledge.
Madam, thank you. Thank you very much. Very glad to hear from you. So we'll start our conversation with first irregular periods. Irregular periods are common, especially in teenage girls, even married women, middle age, and menopause age. Every stage it is common. So first we'll start with irregular period. Why does it comes? And what kind of problems people are facing? What kind of treatment is there in our homeopathy? This I want to hear from you.
See, regular periods of various types. They depend according to the age. Like now we can say amenorrhea, oliguria, and menorrhagia. And like in this, dysmenorrhea is also there. See, for amenorrhea, you will miss your period for about two to 3 months continuously, and sometimes 6 months also the patient does not get her period. And in dysmenorrhea, there is very painful period. Though the period is, sometimes the period is regular and sometimes it is irregular. If the period is regular also, the patient may have pain, severe cramps and back pain, and lower limbs are painful and heavy bleeding and all that. In oligomenorrhea, the period is very less, like it is very scanty, and the patient has sometimes 1 day or a half day or just spotting. And in menorrhagia, the period is very heavy and it is sometimes prolonged to 10 days, 15 days, and so on. So in this way, there are many types of irregular periods.
Madam, thank you very much for the good information. First of all, why does this irregular periods occurs? What are the main reasons we would like to know?
See, the main causes for these irregularities in our periods are of various types. First, they may be genetic, then they may be hereditary, or they may be hormonal changes in the body. Like generally patients with anemia may also have irregular periods. Sometimes the patients may have thyroid problems, like in both in hyper and hypothyroid, the patient will have this irregularities. Sometimes the patient may have scanty flow, sometimes the patient may have heavy flow. And sometimes due to stress, nowadays stress is a common problem. So all the students and all the teenage girls and patients in 30 to 40 age group are facing stress, which is a common problem. Most of these cases in this age group who come with irregular cycle are the cause is mostly stress. Sometimes the causes may be PCOD. PCOD is nothing but polycystic ovarian disease. This is also common. It is due to our regular diet, lack of exercise, and all these problems.
Thank you, Madam. You have given good information. So the main reasons for this problem is stress, anemia and obesity. So why does it comes? Is there any proper treatment in our homeo medicine? This I wanted to focus.
In homeopathy, we have medicines to treat anemia, to treat obesity and stress. So, according to the patient's symptoms and all that, we have medicines to treat anemia, we have ferrum phos, we have various medicines. And to treat obesity, also according to the patient's weight, according to the patient's BMR and his lifestyle and all that, we can give medicines. We can suggest some medicines.
Madam, PCOD is also one of the cause for irregular periods. What is this PCOD? Does it comes to the teenage girls, middle age, and later age also? So when does it comes? What is PCOD? We want elaborate information on it.
Okay, good. Now this PCOD is generally polycystic ovarian disease or syndrome. In this PCOD, there are cysts in the ovary. Cysts are nothing but water-filled bubbles, to tell in a plain language. Generally, we see when we open an egg, it is covered with a shell and then a membrane, thin membrane. So our ovary also has a thin membrane, and every month an egg is released into the ovary, and this is if it is not fertilized, it is ruptured and we have a period. But in this polycystic ovarian disease, when the ovary is covered with a cyst, it means the eggshell ke jaisa. So the consistency is like an eggshell and it doesn't break. So all these eggs every month which they are released are concentrated in the ovary, and this becomes a polycystic ovarian disease. It is a hormonal disease, this polycystic ovarian disease, and it is caused due to the changes in the hormones. The estrogen and progesterone levels vary a lot, and due to this, the disease occurs. In this, the androgen levels are also high. In this polycystic ovarian disease, the androgen levels also become high, and all these hormonal changes cause various changes in the body which lead to irregular menstruation.
Madam, I heard that fibroid is also one of the reasons for irregular periods. What is the difference between fibroid and the PCOD?
See, fibroids and PCOD, they are both different. They both are different. PCOD can occur at any age. Like a patient, a girl with 15 years girl also can have a PCOD, and a adult also can have a PCOD. In PCOD, the irregularities are more. Like it may be heavy flow, or they may be amenorrhea, like there is no flow for 6 months or 3 months or something like that. And the patient may have dysmenorrhea, and the patient may have some other symptoms associated with these irregularities. Whereas in fibroid, mostly it occurs after 40 years of age. It can be in lower age also, but most of the cases are above 40. And in this, mostly the period is very heavy and it is very prolonged, and there is profuse bleeding with lots of clots, and sometimes the color also changes, and there will be severe pains, and for every 10 days or for every 15 days the patient will have her period.
Madam, one more thing. Madam, in allopathy, for fibroid, there is only one treatment, that is removing the fibroid, surgery. But in homeo, I heard there are good medicines. Can you please throw a light on fibroid medicines and how is the treatment?
See, we have medicines for fibroids in homeopathy. We have various medicines. We have pulsatilla, we have sepia, epis, calcareum carb, blacksis, and thuja. But now don't blindly use these medicines. See, I'm just giving the medicine name, but the medicine should be used according to the potency, according to the conditions of the patient, and according to the symptoms. So don't blindly use this medicine. Go to a doctor and consult, and then take the medicine. See, these medicines will generally cure the patient within 6 months, 3 to 6 months, and it will remove the root cause, and the patient will be fine.
Thank you, madam. Thank you very much for giving good medicines. But my dear friends, Don't take medicines by yourself, because Homeo medicines, it differs from case to case, person to person. Please consult nearby your doctor, or else madam number I am leaving at the end of the video. Clinic number, phone number, website, everything is I am leaving. You can consult through online also. Okay? Madam, one of the important problem, how the patient comes to know that they are having PCOD problem, and what are the symptoms? How do they recognize it? This they wanted to know.
See, nice question, madam. There are a lot of symptoms in PCOD. The first thing is there is hair loss in the scalp, but on the body there is lot of hair growth. Like you generally say it is a male pattern of growth for a female. There is growth in the upper lip. You have a lot of growth in the limbs and all that in PCOD. In PCOD, you also have pimples, acne, and there is dark pigmentation around the neck and on the face. And you have disturbed menstrual cycles. Mostly it will be amenorrhea. It will be up to 3 to 6 months, and the patient may also have PMS. Now, this PMS is premenstrual syndrome. It is in this syndrome, before the cycle, the patient has few symptoms like anxiety, stress, dizziness, headaches, and all these symptoms. Due to this, the patient feels very uncomfortable for the days before the period. And there will be estrogen and progesterone level fluctuations. Due to this, there will be many hormonal changes, and the patient will be obese. Generally, this obesity and PCOD are interlinked, and most of the cases of PCOD are obese. But it is not that 100% PCOD cases are obese patients. They may be lean patients also who have PCOD, and they are also obese patients. So it depends. And also the patient in PMS, she may have palpitations, acne, and fluid retention. Now this fluid retention is, the patient may have water retention in the body, due to which there may be pedal edema and all that.
And thank you very much for the elaborated information. We would like to know what is the treatment available for PCOD or irregular periods, especially in homeopathy. Please throw on that, madam.
See, the treatment varies according to the condition and according to the cause of the disease. The treatment varies. But generally, in all the patients, there are some points to be kept in view. Like the patient has to change her lifestyle, her diet, and she has to take regular exercises, which is very important. Regarding diet, she has to go with low cholesterol diet and low fat diet. Oil, sweets, she has to less. And then she has to take regular fiber diet and more protein diet. The patient's condition will be better if she take less carbohydrate diet. And regarding the exercise, the patient should at least exercise for half an hour to 1 hour for 3 to 4 days in a week. And if the condition is, if the menstrual irregularity is due to anemia, then first the anemia should be corrected. We have a lot of medicines in homeopathy which can be used to treat these conditions. And if the patient has any hormonal changes, or if any of her hormones are high or low or anything of that sort, then through diagnostic tests, and we can confirm those, and with that we can give some homeo medicines to correct those conditions. We have medicines like pulsatilla, sepia, thuja, calcarea car, black cis, epis, and many other medicines which will work very efficiently and will treat the case with great fineness.
Madam, thank you so much. Do you know that, as madam said, changing your lifestyle, food habits mainly, and exercises. Better to do yoga always, like breathing exercises, meditation. It will be helpful for you all. And I heard that there are some side effects if you go for allopathic medicines. But in homeopathic, it is quite safe. Madam, let us know how much time it will take for the treatment of PCOD.
See, generally in this treatment of PCOD, in homeopathy, without any side effects, almost 3 to 6 months in mild cases, but in severe cases, it may take up to 8 months. That's all. That will be the treatment.
Madam, thank you so much. We have discussed today many problems, especially what is PCOD, basic knowledge who does not have, they got information, and also irregular periods and also fibroid. These three questions we have discussed in depth. One more important thing is that in homeo medicines, there is no side effect at all. You can use it without any hesitation. This is the best advantage. And if you have still any more problems, I have given you the number at the end of the video. Please consult madam or nearby your doctor also, but always you can be safe. At the end of the video, I would say that madam is quite busy and very dynamic lady, no doubt at all, but she has taken a lots of time for us. So that's really appreciable. Thank you very much, madam, for spending your valuable time. And my audience will be in touch with you. Please treat them and treat them just like my friends in that way. Thank you so much, madam. Thank you.
Thank you, madam. It was nice interacting with you. But I just want to give a advice to all my viewers. Don't take the medicine on your own. Please consult a good homeopathic doctor, or you can consult me through my number or whatever it is. And thank you a lot. And stay fit and healthy.